I was a little skeptical of this topic before I started recording it. So if you're like me, thinking, what the heck is this hokey pokey nonsense? Stick with me because the conversation you're about to hear just might change how you approach hormones, energy, and women's health. I'm Colleen, a PA, dietitian, and your nutrition mentor. Welcome to the Exam Room Nutrition Podcast, your guide to giving better nutrition advice. Today, we're talking about a technique called cycle syncing. And before you raise an eyebrow like I did, stick with me because this might be the missing link for you or your patients. Cycle syncing involves adjusting lifestyle habits like diet, exercise, and even your social calendar to align with the natural phases of the menstrual cycle. Now, if you've ever noticed how much energy levels fluctuate throughout the month, you're not alone. Hormone shifts can make everything from daily tasks to sticking with workout routines feel harder. That dip in motivation or performance, it's not all in your head. There's a science to it. Cycle syncing helps you recognize patterns in how you feel physically and emotionally throughout your cycle. With just a few months of tracking, many people start to see trends that can help them build habits better suited to their body's changing needs. Now, to help us understand how to implement this in clinical practice, I'm joined by Amy Dave, a PA with over 20 years of experience who's taken a fascinating journey from traditional medicine to becoming a women's wellness coach. After experiencing her own health transformation through lifestyle changes, Amy now helps overwhelmed moms reclaim their energy and well-being. Her insights on how hormones influence everything from energy to eating patterns are eye-opening and very practical for patient care. So whether you're navigating your own hormonal shifts or working with patients facing these challenges, you're going to walk away with practical tools you can start using right away. So get comfy and enjoy my conversation with Amy. Well, hey, Amy, thank you so much for coming onto my podcast. Welcome to the show.
Thank you so much for having me, Colleen. I'm so excited to be here.
I can't wait to get into this topic because I don't know anything about this being in the pediatric world. So I'm really excited to learn from you. And I think my audience is going to learn something that they probably haven't learned before either. So I am just really, really curious if you can just give us the definition of exactly what is cycle syncing.
So this is not something we learned in PA school for sure. And I don't think there's a real definition for it, but cycle syncing, the way I think of it, is more of a holistic approach to living with a monthly menstrual cycle. And I first learned about it during COVID. I did an advanced certificate in nutrition, and one of the guest lecturers had introduced me to cycle syncing. So just in a real quick nutshell, our menstrual cycle has 4 phases, which we learned about briefly in school. So the follicular phase, ovulation, the luteal phase, and then menstruation. And your body's doing different things in each of these cycles, and your body responds differently to variety of exercises. And it's also how you book your social calendar. So there are weeks when you're naturally more outgoing and social. And there are weeks when you're more into, reflection and alone time and journaling and that kind of thing.
Okay, I want to back it up a little bit for those of us who forgot some information from school. And if you could just explain the different phases of the menstrual cycle and exactly how cycle syncing would align with the lifestyle changes with the different phases.
Like I said, there's 4 phases, right? There's the follicular phase where your ovary is maturing an egg. Then you have an estrogen, FSH, LH surge in ovulation, in which the mature egg is released. And in the luteal phase, your estrogen and progesterone levels climb to their highest levels for the month. And that's when your uterine lining is thickening. And then the 4th phase is either menstruation or pregnancy, depending on if there's an embryo for implantation. So there are 3 main things that can affect each phase. And it's the foods you eat, the exercises you're doing, and how you're booking your social calendar. So I'll give you some examples of each one. For nutrition, it's better to eat raw cruciferous vegetables like carrots, broccoli, cauliflower, kale, cabbage in the follicular and ovulatory phases. In the luteal phase, your body naturally craves sugar. So you want to have complex carbohydrates to help keep a balanced blood sugar And you want to eat baked or roasted vegetables like sweet potatoes or butternut squash, which will help to naturally satisfy those cravings so you're not reaching for other unhealthy foods. With exercise, you want to do your cardio and your high intensity interval training workouts, the HIIT workouts, in the follicular and ovulatory phases, because that's when you have the most energy. In the luteal phase, your heart rate rises slightly and your energy can be a little bit lower. So you want to switch to strength training or Pilates. And then while you're on your bleed, you want to do gentle yoga or a brisk walk. And that would be, the maximum exercise you would want to do while you're bleeding heavy. And as for your social calendar, you're most outgoing in the week before ovulation and just after. And this is from an evolutionary standpoint. That's when you want to try to find a mate and, procreate and all this stuff. So you want to use that time to book your events, family events, outings with friends. If you're networking for work or if you plan meetings, that would be the time to plan the meetings because you're naturally more outgoing. And then again, at the end of luteal phase and in the menstrual phase, you're more likely to be more introspective. So you want to use that time to reflect on the past month, or you want to journal about any, things you're struggling with. Your intuition is also really high during this time. So you want to scale back on your outings and focus more on you and, just what is your gut saying? What are you journaling about? You may find some clarity and some answers.
I think this is so interesting because it really does have like that whole mind body introspection about how, we choose our activities, what foods that we're eating. And it really helps women be much more in tune with their bodies and what their bodies are telling them. Now, which patient populations might benefit the most from cycle syncing, and why do you think that?
So anyone who has severe PMS symptoms, if they were diagnosed with PCOS or infertility, they can all benefit from cycle syncing. And there's also a population where, like me, I thought I was eating healthy and exercising, but it turns out I was eating too many salads and not enough nutrient-dense foods, and I was exercising too much. So I was doing 45 to 60-minute exercises, and that was releasing cortisol, which was helping me gain weight, not lose it. So I wasn't seeing results, even though I thought I was being healthy. So if you have patients who are like that, where they say, gosh, I'm eating healthy, I'm exercising, I'm doing everything I can, and I still don't see results, I'm exhausted, cycle syncing might be the next up level for them.
Now, I'm going to play devil's advocate here. What would you recommend for someone who maybe doesn't have severe symptoms? They're perfectly fine. Is cycle syncing saying that they shouldn't lift just because it's the phase of their menstruation, or they really should just listen to their body, and if they feel great, they feel like they're doing fine, they can continue with their normal activities?
So it's a little bit of both. And I think I read this in one of the books about cycle syncing, but the U.S. women's soccer team follows these techniques. And you can lift weights in the follicular phase. You just want to do it maybe lighter weights and a little bit faster reps, so you're getting your heart rate up too. Whereas in the luteal phase, you might want to do heavier weights but slower, so you're not raising your heart rate as much. Definitely listen to your body first. If you feel good doing what you're doing and you're seeing results, great, keep doing it. But if you're not seeing results, simple tweaks like this, like just maybe lighter weights but faster reps in the first 2 weeks, and heavier weights and slower reps in the luteal phase might give you more results.
I really love how you approach this, because I have heard some other people talk about this and they discourage women from exercising, on those certain days, where I really like how you are encouraging physical activity, just tweaking it a little bit, listening to your body, working it in with where you're at with your cycle, as opposed to maybe they feel great and they want to exercise, but they just so happen to be in the wrong phase. And now they think that they can't exercise. Now, what would you say for someone like that who feels like they have to stick so strictly to those guidelines? Do you feel as though that there's a little bit of freedom to work with what their body's telling them?
Oh, yeah. Because I used to do just cardio. Like most days of the week, I was doing like 45 to 60 minutes of mostly cardio, and I wasn't seeing muscle growth, weight loss. My energy was still, tanking. And like I said, I switched it up. Now I do about 15 to 30 minutes and I do dance cardio. Then I do Pilates and strength training. And then I switch to yoga. And I have had more growth in my muscles and more like definition than I ever had before.
I really like that you have that variety too, because sometimes like quote, going to the gym or just running on a treadmill, it gets so boring. And so whether it's for, your phases or your cycle phases or not, I think that variety is so great, even just for overall longevity and mental health, going on a walk on that one day instead of maybe just dragging it into the gym, maybe go on a walk and it's really nice and sunshiny. You're getting fresh air. Like I feel as though that is much more beneficial to our overall health, not just our body shape and size, but our mental health and emotional health than it would be than to just drag yourself into the gym. So I really like this concept a lot.
Yeah. And going back into like the holistic concept. So if you do the research and you read about cycle syncing, they also link it to the lunar calendar, where you have 4 phases in the lunar calendar, right? And if you do different things in each phase, you're going to help your body thrive. So you have variety in your exercises, you have variety in the foods that you eat, and you have variety in your monthly calendar. So one weekend might be super booked and you might have the energy to deal with all the events and handle everything. And then the following weekend, you might be home and relaxing and just taking some time for yourself.
Okay, this sounds really, really interesting. And for my listeners who this is like completely new, but it's clicking, like it makes sense. How would someone go about kind of like tracking this, starting this, especially if they're not medical professionals and they're like, I have no idea what phase is happening when? Is there a way that they can kind of start to put things in place in the right week?
Yes. First thing you need to do is start tracking your cycles. Okay. And you can either do this with a paper calendar or there's a number of apps that have this. And the lady who wrote the books on cycle syncing, she actually has an app. It's called My Flow, where you can put in the date of your period and it kind of lines it up for you. And in her app, it's really great because you can add your symptoms too. So you can track like on this day I had cramping, on this day I had whatever, bloating, on this day I was really tired. So the first step is to know when you're having your bleed, if they're coming monthly, because if your periods are not regular, the first step would be to get them regular. And then once you're having monthly cycles, and if you're trying to conceive, maybe you've tried ovulation test kits or you're following the app and you can kind of tell based on the way you're feeling, your cervical mucus changes during ovulation. So you can tell if you're ovulating, but the easiest way is to start tracking it. And then as you get familiar with the phases, then you can start to incorporate all these changes.
Okay, that's really, really helpful. And I'm sure some listeners are like, oh, yeah, I should be tracking that. And it's more than just tracking like when you had your period, right? So it sounds like you do need to get a little bit more familiar with exactly like what's going on. So I think that is an excellent first step for my listeners, but also for providers to educate their patients. Because if they're not tracking their periods, they have to start with that, right? They have to start there. And being in the pediatric world, I actually educate all of my teen patients on the importance of knowing when your period is coming, knowing how long your cycle is. But now this leads really nicely to when they're in the adult world and really understanding what's going on. Really important piece of education for patients there. Okay, I know you mentioned a few different foods that we can be eating during each specific cycle, but are there any other foods or maybe nutrients that we really should be focusing on during the specific phases?
I'll give you some more examples. In the follicular phase, you want to eat, of course, you're eating your vegetables and your whole grains and lean proteins and things, but you want to focus on fermented foods. So yogurt, kimchi, or sauerkraut. Anything that's been fermented helps with digestion in this phase. During ovulation, you want to stick to lighter grains, lighter foods. So you're going to be doing more salads, smoothies. The grains would be something like corn or quinoa. You don't want anything too heavy. And then in the luteal phase, you need extra B vitamins. magnesium, and fiber. So things like chickpeas and dark leafy greens are really great in this phase. And then while you're bleeding, you want to eat iron-rich foods to replenish the iron that was lost while bleeding.
I love that. And it sounds like the focus really is on those whole foods, fruits, vegetables, fiber. And, dietitians have been preaching that for decades about how important those types of nutrients are. And now it really just makes sense that just those few little tweaks can really help you throughout your cycle. So I know we've talked about fertility, PCOS. Are there any other medical conditions that this approach might be beneficial for? Has the research looked into any other diseases?
So it can help boost fertility. So if anyone's struggling with an unexplained fertility, actually for the male partner too, healthy lifestyle can boost sperm counts and things, but it can help with that. And actually during pregnancy in the cycle syncing techniques, it's considered a elongated menstrual phase. So you should be eating the same nutrients and doing the same kinds of exercises and things that you would be doing in that, like in the luteal to menstrual phase. And like I said, if you have a patient with severe symptoms, right? Somebody's complaining of, I get acne and I get cramping and bloating and I can't get out of bed. And the only thing you can think of is a birth control pill. That's like a Band-Aid that we're doing with everything else. If somebody has diabetes and the only thing you can think of is let's get you on a medication. If you have high blood pressure, let's get you on a medication. There are lifestyle changes that we can try first to see if that helps.
Yes, so true. And I'm glad you went there and that you mentioned hormonal birth control, because I'm curious if this is still applicable for someone who maybe is already, taking or has been taking OCPs for a really long time, or maybe those with irregular cycles. Would this still be applicable for them?
So let's start with the irregular cycles because we already talked about that. The first step is to get them as regular as we can, just by cutting out the inflammatory foods, maybe starting exercise if they haven't actually done anything. Now, if you're on birth control, your hormone axis is shut off, right? So the hypothalamus releases the hormones to stimulate the ovary and all that. And those things are all just kind of turned off if you're on birth control. So you could still use the cycle syncing methods just to live a healthier lifestyle. But I don't think you would see as much benefit on the birth control, but you could definitely use it as a way just to live a healthier lifestyle. And the second thing that this helps with is when you come off birth control and you want to try to get pregnant and you want to get your cycles back, syncing can help them come back faster and more regular.
That's what I was actually just thinking as you were talking about the woman who's maybe been on birth control because of acne, because of PMS or dysmenorrhea. I feel as though this might be a great option to get off birth control, and then you can try to start cycle syncing instead as a treatment for whatever symptoms you are trying to treat with birth control. So I think that's a really interesting trial that maybe some of the clinicians can use with some of their patients in clinic.
Yeah. And if it's confusing to them, like if they can only say, the only thing I know to do is birth control. There's a lot of coaches like me out there. I'm not the only one. They call themselves hormone coaches, PCOS coaches, fertility coaches. I mean, find somebody to help that lady.
Mm-hmm. I agree with you on that because this is definitely out of a lot of clinicians' wheelhouse. So you do have to be very confident and comfortable with it and making sure that you're giving accurate information. I'm curious if there's any red flags or maybe contraindications that clinicians should be aware of, especially with certain patient populations.
I don't really know because you're not doing any kind of severe caloric restriction. You're not doing any intense exercise regimens. I mean, you can do HIIT, but you do it to what your body can handle. It's not, too hard on you. But if you're just everyday person, I don't think there would be any major red flags because you're just doing healthy eating, right?
Mm-hmm.
You're eating whole foods, fruits, vegetables, lean proteins, whole grains. You're just varying which ones you eat.
Mm-hmm. I feel like this would work well for people who like to track things, maybe like type A people or those who are very used to like the diet, train. They've jumped on one diet onto the next and who like that kind of guidelines and that kind of tracking. I wonder, has any literature looked at any risk of eating disorder? You know how sometimes individuals with eating disorder are more prone to like obsessive compulsive behavior. Does this lead towards that or no?
It could, maybe. I think at this point, I mean, you could get obsessed with tracking your cycle, but there's not much you could do to change it, right? If your period comes, it comes. If it doesn't come,
Right.
But if you're not eating enough, it may not come, right? So that might be one of the issues to get a normal cycle is you're not eating enough.
Yeah.
Or if you're eating too much, if you have too many inflammatory foods, that might be another reason why you don't have cycles. That's a common symptom of PCOS is not having a regular cycle.
I think it's so interesting. And like with anything, I think the clinician needs to know the patient that's sitting in front of them and know what might work best for them. And I think, like you had said, it's just a really great way to be in tune with our bodies, to vary our diet, to vary our exercise. And I think a lot of people might find that it naturally works really well for them once they are aware of like, oh yeah, that makes a lot of sense. I'm like full of energy this week. And in 2 weeks, I'm exhausted and don't want to see anybody, so it just kind of naturally fits and flows into just a woman's body and how we were wired. Wouldn't you say that's true?
Yes, definitely. The lady who I first learned cycle syncing from, her name is Lisa Vitti, and she has 2 books. One is called Woman Code and one is called In the Flow. So in Woman Code, she has this huge chart of each phase listed out, what foods you're supposed to eat. She has a whole list of like, here's the foods, here's the exercises you should be doing, here's how you should be functioning in your marital relationship. She has this whole big chart. So I actually printed that out and I have it taped to the inside of my kitchen cabinet just as a guide, right? And then in her second book, In the Flow, she actually goes into how do you incorporate this at work and how do you incorporate it into motherhood and how do you change your parenting styles. And if you'd like to read more on it, I really highly recommend those 2 books. So it's In the Flow and Woman Code by Lisa Vitti.
Oh, that's really helpful. I'm going to link those down in the show notes below for you guys to check out later. But Amy, where can people hang out with you? Or maybe if they're like, oh, this sounds awesome, I want to learn more, I need to work with her, where can they learn more about this?
So I do have a free guide available on an introduction to cycle syncing. And you have that link. So just if anybody wants it, hit the link and grab it. I'm pretty active on social media, both on Facebook and Instagram. You can find me at The Wealth of Wellness, LLC. And I also have a YouTube channel where I post health and wellness tips.
So cool. I can't wait to see where the science goes with this because it's newer, and a lot of people don't know about it. So it's going to be really, really interesting just to see where everything goes. I'm so grateful that you spent this time with us and just shared this information. And I just thank you so much for the gift of your time. Thanks for being on the show.
Thank you so much. And I hope you guys learned something new today.
All right, now it's time for my nutrition notes. Now, I truly believe that when you have the right information, you have the power to change your life. Every patient experiences their menstrual cycle differently. Mood swings, food cravings, cramps, and migraines can all be linked to hormonal changes. The uncertainty of not knowing when these symptoms will arise can make it difficult for your patients to plan their work and social calendar. I think we should encourage all of our patients to track their cycle for several reasons. Now, the most obvious is for fertility and knowing when they are ovulating. Also, tracking helps women anticipate their next period and can reveal shifts in the cycle that may indicate underlying health issues or lifestyle changes. Additionally, it can help manage those uncomfortable side effects. Now, a final tip to consider is how nutrition can impact acne, which is a common concern related to the menstrual cycle. There are a few debatable foods that I want to unpack real quick for you in these last few minutes. Dairy, high glycemic index foods, chocolate, and fried foods pop up a lot in the literature with regards to acne. So I'm going to break those down quickly for you one by one. The relationship between dairy and acne is actually still debated, but some observational studies suggest skim milk could exacerbate breakouts. So I would suggest you encourage patients to first monitor how different types of dairy affect their skin by just keeping a food journal to monitor how their skin responds. If they do choose to reduce dairy, it's very important that you discuss other sources of calcium and vitamin D to prevent any deficiencies from occurring. Next is high glycemic index foods. These are foods like sugary cereals and white breads. These may contribute to acne by triggering blood sugar spikes and inflammation. Now, I am in no way suggesting that you tell your patients to, quote, avoid all sweets or anything that extreme. However, encouraging them to focus on fiber-rich, complex carbohydrates most of the time can benefit both their skin and overall health. Next up is chocolate. So when it comes to chocolate, the science shows that it might be the sugar and dairy that's in milk chocolate that plays more of a role in acne flare-ups rather than the cocoa itself. But you can always encourage your patients' moderation and, of course, opting for dark chocolate with minimal added sugar. Lastly, while fried foods don't directly clog pores, diets high in trans and saturated fats can promote inflammation. I would suggest you talk to your patients about anti-inflammatory foods like avocados, nuts, and fatty fish as skin-supportive options. So when it comes to diet and acne, I would recommend you start small and suggest 1 or 2 manageable changes rather than a complete dietary overhaul, which might be unnecessary. For example, I would recommend swapping sugary drinks like sweetened tea or fancy Starbucks coffee drinks for water or eating a handful of nuts as a snack. Addressing diet and acne with patients requires extreme sensitivity and a focus on empowerment. The best dietary approach is to address each patient individually and carefully consider the possibility of dietary interventions. Well, that's all I have for you today. Now, if you loved this episode, please share it with a friend or colleague, or you can always let me know by leaving a review in Apple Podcasts. Until next time, my friend, let's continue to make our patients healthier, one exam room at a time. I'll see you next time.